Good afternoon. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Today there are 2 new cases of COVID-19 to report, taking our total to 300. As of this morning, 284 individuals are listed as recovered, and there are 9 active cases. Yesterday, 671 lab tests were completed, taking us to a total of 47,372. And so as we've been able to gradually reopen our economy, Manitoba's numbers have stayed favorable, but we've ensured we continue to message that this is not a return to normal, that Manitobans are still going to have to deal with this virus in one way or another for the foreseeable future. We're certainly not done with this virus. We want Manitobans to learn how to live with this virus so we can continue to reopen things gradually and cautiously. We want to continue to ensure that Manitobans can connect with each other. So as we gradually reopened, we always had that messaging that it's a permissive reopening. We wanted to leave the public health restrictions on for as short a time as required, but it's certainly not a directive. There are many businesses that are taking their time to open. Certainly, no one's directed to open at this time when the restrictions are loosened. So everyone's doing what's they feel is best and what's going to work best and safe for them. And that includes all Manitobans. Each Manitoban is going to have to decide on the level of risk that they are able to take. Certainly, we can't live in a zero-risk situation with this virus. Things like washing our hands frequently, ensuring physical distancing, avoiding large crowds, enclosed spaces are our best ways to minimize our risk to this virus. And moving forward, what we really need is that all Manitobans to work together to stay home when you're ill. In this new normal, we can't have the same as what we've all experienced in the past of people showing up to school or to work or out in public showing symptoms of illness. So even mild forms of respiratory illness, we can't have people going to work. Certainly present for testing, but for the most part, we need you to stay home when you're ill. And so this can apply to all Manitobans. So employers, we want to make sure that there's a screening process for employees, so employees aren't coming to work sick. We want to make it easy for employees to stay home if they are sick. We want to make it easy for employees to stay home if they're advised to self-isolate. The alternative is that they come to work when they should be self-isolating, or come to work with mild symptoms instead of staying home. So looking at your policies and practices to ensure in the new normal there's opportunities for people to stay home when they're ill. The same applies to children and their parents. We can't have kids going to work or to school when they're ill. And as we open up sporting events, we're trying to get Manitobans active again, enjoying the summer. But again, we can't have people showing up to these sporting events if they're showing symptoms of illness. We have to all do our part to keep the success of our reopening plans moving. And so as we continue to work on this, we're going to be able to continue our success, continue with our gradual reopening, but we're going to require all Manitobans to do their part, staying home when they're ill. If you are out, certainly coughing or sneezing into your sleeve, washing hands frequently. But this is something that we're going to need to be doing moving forward in our new normal. Those at increased risk of severe outcomes, those over age 65, those with underlying medical conditions, especially respiratory or cardiac conditions, those with immune compromise are at increased risk, have to take extra cautions, and people around them have to take extra precautions to ensure that their risk is minimized to acquire COVID-19. And that includes all those things that we mentioned before: frequent hand washing, limit exposure to large group settings or enclosed prolonged exposures. Manitobans should continue to access credible information at manitoba.ca/COVID-19 for up-to-date information. And once again, thanks to all Manitobans for stepping up and putting us in this position so we can continue to gradually reopen things here. And I'm going to pass over to Lanette.
Thank you very much. I'm Lanette Siragusa, Chief Nursing Officer with Shared Health. Good afternoon. Hospitals and health centers across the province are working as we speak working on the new visitor guidelines over the next few days. These new guidelines will strike a balance between appropriate preventative measures while allowing patients to maintain connections with loved ones that are important to their health and well-being. Several hospitals will be loosening these restrictions on Monday, but some facilities are expected to begin welcoming visitors today. So we encourage people who have been designated as a patient support person to confirm with their sites or with their site and make sure that they are open and accepting visitors before they arrive. It is also important to note that these new guidelines are specifically intended for patients who are admitted to inpatient beds in the hospital. They do not apply to outpatient services. And what I mean by outpatient services are patients who come to the hospitals or the healthcare facilities on a short-term basis for appointments or tests or assessments or minor procedures. These new guidelines also do not apply to the personal care homes, which for the past week we have facilitated the outdoor visits for residents to connect with their loved ones. We will continue to discuss and review our guidelines and policies and adapt our response as the pandemic evolves. So I want to thank Manitobans for their continued patience and their understanding. I do want to speak about testing sites. There are some scheduled changes happening this weekend that I want everyone to be aware of. A number of sites will be closed on Sunday due to low patient volumes. This includes Portage La Prairie, Steinbach, and Winkler testing sites, as well as the Thunderbird House site in Winnipeg. As a reminder, anyone who has symptoms consistent with the virus are encouraged to get tested, and a full list of site locations throughout the province, the hours of operations are available online at manitoba.ca/COVID-19. And last, I wanted to give you a quick update on our alternative isolation centers. As a reminder, these are centers that were developed for those who cannot safely self-isolate at home or for vulnerable populations experiencing homelessness who need a safe place to self-isolate. They also provide space for healthcare workers and other Manitobans who have or are suspected of having the virus and can't safely self-isolate at home. We can report the hotel program accepted one new person into the program within the past week, and there are 13 people currently isolating at the hotel. And since its launch on April 4th, we have had 31 people stay in the hotel. Meanwhile, the shelter program accepted 10 new people into the program last week, and there are currently 7 people isolating at this site. And since its launch on April 10th, 117 people have been accepted into that isolation program. So the number of people who have been isolating at the sites vary day to day, but has hovered around 7 for the past month. And so with that, we can open the lines to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon from Global, Joe.
Hi there, Joe Scarpelli from Global News here. Wondering what direction you'll be giving to transit riders and operators when it comes to wearing masks.
Yeah, so I think our messaging on the non-medical masks is much the same. Our messaging is that by far the most important things are to maintain physical distancing, hand hygiene, staying home when you're ill. But in places where physical distancing is just unlikely to occur the entire time, then certainly non-medical masks are an option. Certainly in places like transit, it's certainly a good option to have, but we wouldn't be mandating it at our level.
And my second question is about tonight's rally. If people aren't social distancing over there, should they be self-isolating afterwards, or do you recommend they go get tested?
Yeah, so I mean, I think that the messaging is to stay safe. Large groups. The problem with large groups is the larger amount of people that are present, the more likely someone there has at least mild symptoms and could potentially spread. So that's why we limit group sizes. So lots of hand hygiene, ensure physical distancing when all possible, use of non-medical masks are an option. So I would advise anyone in those circumstances to monitor symptoms very closely. I don't think we'd have specific advice on self-isolation, but certainly those at high risk of severe outcomes shouldn't be attending, or should do so very cautiously, engage in large groups, but very close observation for symptoms.
From the Brandon Sun, Kyle.
Hi, this is Todd Iverson from the Brandon Sun. This is a question for Ms. Siragusa. I was just wondering if you could reveal, I guess, if we could be described area by area, which hospitals reopened their visiting hours today, and if that includes the Brandon Regional Health Center at all?
I don't have specific. There's, I think, over 70 hospitals and healthcare facilities across the province, so I don't have those specifics. But I would say that anyone who's waiting to go in, they will be contacted by the sites to make arrangements and share information as to when to come and what day. So, and they may also be posting it on social media on their website. So I can follow up with that, but it's really more the sites who are doing the communication on the details.
Okay, thank you.
From CJOB, Diana.
Hi, Diana from 680 CJOB. Dr. Rusin, with respect to the 2 new cases being announced today, what do we know about their transmission? Are they linked to the truck drivers in Winnipeg in their 20s who were reported, I believe, last week?
Right, so we don't have a link there. One of these cases is a truck driver that traveled outside the province, and the other is a close household contact. So we know that these 2 cases are linked directly or indirectly to the travel outside the province.
Okay, thank you. And then just as a follow-up, if all goes to plan as far as the reopening and phase 3 rolls out possibly later this month, might that include sort of larger group sizes for outdoors? I know a lot of high school grad classes are getting really creative to celebrate their grads virtually, but might we see gathering sizes increase to the point that would allow sort of socially distanced graduation celebrations outdoors? Some parents are kind of frustrated that they can go shopping in malls that have hundreds of people indoors, but they might not be able to see their child cross the stage even outdoors this year.
Yeah, so we are looking at those group sizes, and it's something that will definitely be considered in the near future. I don't have any details on what those numbers would be, but that's part of our phased approach, is to gradually increase those group numbers.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from the Winnipeg Sun. Question first, I guess, for Dr. Rusin. Obviously, I think there's like three cases in truck drivers in the last week now. Just aside from obviously it's travel or soon travel related, are there any trends between the 3 of where they traveled to and came back from that you're seeing yet, or is it just a coincidence, I suppose?
Yeah, so I mean, don't have the details on this newest one, but We know that travel outside of Manitoba, especially into the U.S., carries with it increasing risk. So there's not really any specific trend. There's just, we know that Manitoba's numbers have been quite favorable. So any travel outside of Manitoba increases that risk. So we know that we work quite closely with the Manitoba Truckers Association, and we've implemented the option for asymptomatic testing on those that leave the province regularly. And from our understanding, the preliminary on these cases here are that they're doing everything correct, watching for symptoms very closely, getting tested as soon as any symptoms develop, and limiting those contacts. So we know it's necessary for the transportation of goods. We need that, so we need to accept some level of risk for it. But from all of these indicators, things are being done right.
Thank you. And just my follow-up for, I suppose, Lanette. Heard a couple unconfirmed reports now, people calling HealthLink in the last day or two regarding attending tonight's rally. They've said that I guess the suggestion is because the rally is expected to have over 50 people, and maybe people not being able to social distance. Sorry, have they said they've been told that perhaps recommended to self-isolate after attending the rally? Is that true? Is that being told to people?
That's not our understanding, and we have been in contact with HealthLinks and just confirmed that that is not the messaging that's been given.
Okay, thank you.
From CBC Radio Canada, Gavin.
My question, Gavin Woodcock from Radio Canada. My question is for Dr. Roustan. Is it a provincial directive preventing bars and pool halls from operating pool tables right now?
Right now, in phase 2, the billiard tables, those groups within bars that have where people would gather are closed at this point, and that includes the billiard hall. So, just like any phase, we review these things on an ongoing basis, and we're going to continue our reopening plans if the numbers are staying there. But at the beginning of phase 2, that's what was included.
Some of the pool hall employees and owners I've spoken to question why, for example, bowling is permitted and not pool. Could you give me a bit more of the rationale for this health directive?
I think, when we have a phased response, the overall answer is we can't open everything at once. And so that's the overall way of looking at this, is that we need a phased approach. And I think at every phase, we look at things, we try to look at as many sectors as we can and industries, and try to do so in a evidence-based manner. And when you implement it, there would be always in every phase that we do a group that felt that they should have been opened at that time. And but we just can't open everything at the same time, and billiards something that actually we're looking at very closely right now, possibly ahead of phase 3, but we don't have any details on that now. But with all these things, there's a lot of sectors, a lot of industry. We're moving fast, trying to get as much open in a safe manner, and so we'll continue to review things as these kind of comments come in.
From CBC Manitoba, Aidan.
Hi, my question is for Dr. Roustan regarding the cluster linked to temporary foreign workers in Sutherland Health. I believe on Wednesday you said that there were still a few, I think 3 tests that the results had not come back yet. So have those results come back, and what are they?
Yes, those have all come back. They're all negative. So just the 4 cases remain at that site. There was 2 close contacts that had negative tests, but because they're close contacts, they're still going to be required to self-isolate for the 14 days.
Thank you. And further to that, I believe also on Wednesday you said that you didn't have the specific details on whether the workers had been actually working during their 14-day isolation period. following arriving here. So do you have clarity on that? And can you say if they were working during that isolation period?
Yeah, not during this. They all isolated for the 14 days and weren't working. They were isolated during that time.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Rusin, on these latest two cases, do you have information at this point as to whether the trucker had self-isolated or whether there are a number of contacts that have to be traced?
Yeah, I don't have a lot of details on that as of yet. The public health investigation was ongoing. I didn't get an update on that as yet. I just know that the case was a household contact.
And is the government contemplating, as you said, the trucking has to continue, goods have to continue to be brought into the province. Aside from the asymptomatic testing and the self-isolation, are you contemplating any other measures to help prevent, truckers from bringing this in?
Yeah, so we've sent out a lot of guidance to the industry on things just like that, on how to protect yourself while you're away, and then upon return to monitor symptoms very closely. You have the option of the asymptomatic testing, and then for the most part to limit contact with others. Even though you're not required to self-isolate for the 14 days, we still want to avoid large groups and things of this nature.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy here from CTV Winnipeg. My question is for Dr. Rusin. It's a follow-up to transit and masks. Mayor Bowman spoke this morning and said that they were looking to health officials in the province for recommendations when it comes to wearing masks on transit. That comes after direction from the federal government about that specific topic. So what will your recommendation be to the city? What kind of wording will you be sending them?
Yeah, so we certainly won't be having a mandate. We won't be requiring people to wear masks in any situation in public. Certainly not at this point. It's the same message as before. We really want to not have masks as a distraction to the most important things to do here, is to stay home when you're ill, to physically distance whenever possible, to frequently wash your hands. On areas where it's not possible the whole time to maintain that physical distancing, then certainly a non-medical mask is an option, knowing that it doesn't protect you, protects the people around you. So we could have that recommendation if physical distancing can't be maintained, but we sure wouldn't be in the position right now to mandate that, to require it.
So would your direct advice to transit users be, given that on a bus there can be challenges when it comes to physical distancing, then to wear a mask?
Appropriate for the person. It's there's a number of people that find it difficult to wear masks, and we don't want to be in a position. You may have heard of discrimination against people who aren't wearing masks when there's sometimes a good reason why they're not able to. So our message is the same as it's been, is that there's much more important ways to protect ourselves from the spread of COVID. If you can't physically distance, then certainly wearing a non-medical mask is an appropriate option to use.
From the Winnipeg Free Press, Carol.
Good afternoon. It's Carol Sanders at the Free Press. I'm just wondering, with the testing numbers below capacity right now, is there any benefit to having people who attend a rally or somewhere where physical distancing can't be maintained to get tested for COVID-19?
That wouldn't be my recommendation. So the value of the testing is most in those who are showing symptoms. Asymptomatic individuals, the value of testing is much lower, and we have a very low positive test rate. In the last 7 days, it's 0.22%. So quite low compared to Canada's average right now is about 5%. So it's not an overall recommendation for people to go get tested if they're symptom-free. It's not as valuable.
My follow-up question is for Lanette. Lanette, when you said that you'd take a look into signage at testing sites, there's still some signs up. I know at least one site that say by appointment. What did you find, and was it a concern?
I sent out an email saying that our signage has to reflect our current operations. I didn't specifically ask which sites have which signage.
Okay.
Thank you. We have a few minutes left this afternoon. If our reporters on the line have any further questions, please ask them now.
Hi, Dr.
Dr.
Ruth,
Diana from CJOB.
asked about the phased-in reopening. When you were looking at what businesses could reopen, did you take into account places that their primary service is serving alcohol? Was alcohol part of the decision-making process for who got to open when?
I don't think that there was that was a sort of primary measure. We're just looking at overall the type of venues that we see, that we had completely shut in the past, and trying to reopen things. So I don't think the alcohol component was something we used to decide. Certainly relevant as we're trying to describe the establishments that can open.
Aidan from CBC News. The question is for Dr. Rusin. Is the province currently investigating any possible cases of NISC or Kawasaki?
Yeah, I'm not. None have been reported to me. We have a very close connection with, with all of the hospitals and acute care facilities. To benefit of being relatively small province like this, so I'm not aware of any specific cases that are being worked up. Certainly, Kawasaki's disease is a vasculitis. It's one of the most common vasculitis we see in children. So that's diagnosed, every year in Manitoba. But I'm not aware of any cases linked to COVID-19.
Dr. Ruth and Diana from CJOB, are you able to say how many cases of COVID-19 in Manitoba have been truckers or their contacts? I know obviously there was that cluster in the Prairie Mountain Health region, and a couple of cases popping up in Winnipeg lately. Do you have a number on how many truckers have contracted the virus in Manitoba?
No, I don't have that in front of me. I just know like the four most recent cases in Winnipeg, 3 of those are truckers.
Dr. Wilson, it's Steve Lambert from the Canadian Press. So regarding the truckers, because they're not required to self-isolate, are there other requirements such as, mandatory testing upon their return from the U.S.?
No, we're not doing mandatory testing. We certainly have the option, the voluntary basis for asymptomatic testing. The messaging is that you're not required to self-isolate for the 14 days upon return, but you should take caution. You should ensure you're keeping eye on your symptoms very closely, and avoid large gatherings and unnecessary exposures.
Hi, Aidan. Question for Dr. Rusin. I believe that the request for quotation for antibody test kits is set to close tomorrow. So what have the results been of the RFQ thus far, and is it possible we could see antibody testing by the end of the month?
Yeah, I don't know the exact time frame. We're certainly looking at that. And again, what's really important to note is that when we get these antibody tests, the serology test, we're looking to do a seroprevalence study. So this would be a study to choose some sort of sample of Manitobans, likely ones that are having blood work done for other reasons, and just trying to find out using that as a indicator of the prevalence of infection throughout Manitoba. So it's not going to be something where people are going to be advised that they're immune, because we don't know that these antibodies confer immunity. We don't know if they confer immunity for a long time or at all. So this is going to be this initial round. What we're doing is strictly a seroprevalence study, so that we can try to report what we estimate the actual proportion of Manitobans that have been exposed to COVID-19 is.
Hi, Joe from Global here. In terms of from some viewers saying that they've been calling the Grace Hospital asking when they can see loved ones, and the person on the other line didn't really know the answer. So just wondering what the communication plan will be going forward as this is rolled out.
It's my understanding that the sites will be calling the designated support person, which is part of the patient's record. So random people calling, they wouldn't know the right answer to say. They're specifically reaching out to the designated support people that have been identified, and we'll work with that person and the patient to determine who the visitors will be and when they can start coming. So wait for a call.
Hi, Aiden from CBC. Question for Ms. Siragusa. Is there a plan for when day programs for adults with intellectual disabilities will begin to reopen?
We're in discussions about that, and we'll provide an update when those changes are coming, but not at this exact moment yet.
Thank you, everyone. This concludes today's media briefing.
Thank you.
Thank you.